The great Mahatma Gandhi said, freedom is not worth having if it does not include the freedom to make mistakes. Welcome to the Guyana Dialogue. I'm your hostess, Shamiza Ali. Good evening to everyone joining us on Facebook and on YouTube. I hope everyone is having a productive week so far. Tonight, our discussion will be on healthcare modernization and challenges. The Guyana Dialogue is being sponsored by a coordinating council of Guyanese based in the US, UK, Canada, Guyana, and the Caribbean. Funding support is by well known philanthropist Dave Narayan from Dave West Indian Imports. Please welcome my moderators for tonight, Dr. Tara Singh. Welcome, Dr. Tara.
Thank you very much.
Pleasure
It's a
having you here this evening. And please welcome Professor Gangadas.
Hello, Shamisa. Nice being here. Thank you very much. Hello,
Pleasure
yeah.
having
everyone.
you as well. And so good to have you guys this evening. Such an
Um,
honor to be here as well. I will now introduce our speaker for tonight, Dr. Frank Anthony. At the University of Guyana as an adjunct professor in public health and consulted for several organizations in the area of public health. From 2006 to 2015, he served the people of Guyana as the Minister of Culture, Youth, and Sports, and as the Shadow Minister of Health from 2015 to 2019. He also served in various capacities, including the Executive Director of Health Sector Development Unit, member of the Guyana Medical Council, member of the Constitution Reform Commission, member of the University of Guyana Council, vice chair of the Ethnic Relations Commission, among others. He currently serves as a member of the executive board of the World Health Organization, chair of the Guyana Global Fund Country Coordinating Mechanism, and the Caribbean representative of the UNAIDS Program Coordinating Board. Please welcome the Honorable Dr. Frank Anthony.
Well, thank you very much, Shamisa, and
Pleasure
it's
having you this evening.
thank you so
And
much.
Dr. Tara, I will now hand it over to you.
yeah. Thank you very much, Shamiza, and welcome to Dr. Frank Anthony. I know you have a very busy schedule. You, like the other ministers, you have revolutionized the concept of democracy in that you have been taking government to the people. I don't think in any country in the Caribbean or any part of the world people have seen governance at this level. So I want to congratulate you for being part of that. I know over the weekend you did an outreach somewhere in the East Coast. I think it was Pigeon Island or somewhere, and then you had a
There was
remarkable launching of the maternity hospital, which you can probably tell us about. But before we go into that, I would like if you can give us an update on the COVID and monkeypox situation in Guyana.
so thank you very much, Dr. Tara Singh, and it's nice to see you, Dr. Ganga, Professor. It has been quite a while, but it's so nice to see you all a bit virtually and to have this conversation with you. I think with COVID 19, as you know, in most of the world, we have the BA5 that is circulating. This is a subvariant of the Omicron COVID virus. And we think that this is the dominant variant that we now have in Guyana. So a lot of people are getting flu-like symptoms. Fortunately, we're not seeing so many people requiring hospitalization, but we do have people in hospital. So on a daily basis, we probably would diagnose maybe about 100, 120 new cases. Over the last 24 hours, we had about 100 new cases. We currently have 20 persons in our hospitals across the country, and most of those persons are at the Ocean View Hospital. We currently have one person at Ocean View who is in the ICU. So I think generally with COVID, we have not been doing too badly. We have lots of diagnostic capacity. We can do rapid tests, and these tests have been circulated to all our public facilities, so you can go in and get one of these rapid tests done. But if you need to do PCR to confirm, we have that capability as well. You know, when we came into government 2 years ago, we did not have this type of capacity. And in fact, for the whole country, we're probably only capable of doing maybe about 5 PCR tests per day. We have since built capacity where we can do between 2,000 to 2,500 PCRs per day. And that's a big advancement. We don't use all the capacity, but we have it if it's necessary. And we have been able to put in PCR machines in the various regional hospitals. So when we first came in, persons had to send samples from, let's say, Region 9 to Georgetown to be tested. And sometimes it takes maybe 9 days for a turnaround. So by putting PCR machines in the regional hospital, you can get turnaround within an hour because some of these machines are designed to give you tests faster because we have been using some gene expert machines. So I think in terms of the management of COVID, we have built a lot of capacity, we train a lot of people, and we have averted a lot of deaths by doing that. As you know, we have vaccines that are available. And first and second dose, we have done the primary doses, we have done pretty well because our numbers are in the 70s. First dose, about 79. And a couple months ago, we have introduced vaccines for children between 5 and 11. And so right now, we have administered about 6,000 doses of the children vaccine. So vaccination has been going good. I think like everywhere else, we have had a challenge with booster doses. Not a lot of people want to take booster doses, but nevertheless, so far we have been able to administer about 71,000 booster doses. But we remain optimistic. We have had lots of partners who have helped us on this journey. And as you know, the United States has made a commitment to us that all our vaccine needs, they would be able to provide vaccines for us. And so tomorrow, we are going to receive a shipment of 50,000 doses of pediatric vaccines that are coming in from the US as a bilateral donation to us. And we are going to use that to boost our pediatric program. As it relates to monkeypox, we haven't had any cases yet. We have been in preparation mode. We have sent some of our staff from the National Public Health Reference Lab to be trained. They have been trained, they have returned, and in turn, those persons who have trained all our regional laboratory staff in how to take the samples and what to do with the sample, how to run the tests. We have brought in the reagents to run these tests, and so we are prepared. So if we have any suspected cases, we'll be able to test them locally and to confirm the diagnosis. We've also put out specific guidelines as it relates to monkeypox. We have put a team together to respond to monkeypox. We have a team of experts, infectious disease specialists, epidemiologists, and clinicians, and so forth. And once we have a case or we have a suspected case, this team would go out and to verify, and then we can take the requisite actions. If it's necessary to isolate that person, we have capability. We have set aside rooms at the Ocean View Hospital where we can do such isolations. But again, we are very pleased that so far we haven't had any cases, but nevertheless, we have prepared our system to respond if we have any cases. As you know, this.
Have you
Go ahead. Go ahead.
have you started a public education program on monkeypox?
Yes, we have started that, and we have done a series of what I would say stakeholder education programs. So we have been reaching out to persons who we feel are more vulnerable to the disease, and we have been talking to them going into their community and talking to them. And I think that's very important at this point in time.
So what precautions should citizens take with respect to monkeypox?
Well, if person presents with rash and fever and things like that, they should report it immediately, isolate themselves, and let the clinicians be able to make a proper diagnosis, and we can confirm that with our labs. Because there are many things that can mimic monkeypox, right? And so we don't want people to panic as well. So we need the experts to verify, and once we're able to do that, then we take the next steps. Uh,
Okay, thank,
but our medical professionals, we have sent out guidelines as to what to look for, and once they're able to identify cases, then we'll respond appropriately.
yeah. How is the situation? How is the situation with HIV/AIDS? Um, is that under control?
Well, with HIV, we have done quite a lot of work. In terms of HIV, we probably have about 8,000 persons who are affected by HIV. Most of these persons have been able to get a diagnosis. We have most of them on treatment. Treatment is provided free of cost, right, by the government. And what we are working towards is to make sure that they're virally suppressed. So we are doing a lot of work on that front. We have also introduced some new measures over the last 2 years that we have been in office to make sure that we can do more on the preventative side. And so we have introduced comprehensive pre-exposure prophylaxis. So that now is available to everyone. If you believe that you are vulnerable to HIV, we can give you treatment up front so that if you are exposed, you would not contract HIV. And that's the essence of the pre-exposure prophylaxis. So we have started that program. We have gotten good responses. So we feel through that program, we'll prevent a lot of infection. We have also introduced self-testing, meaning that you don't have to come to one of our institutions to be tested, but we can send you the kit, or you can collect one of the testing kits, and you can test at home or wherever you feel comfortable. And if you test positive, you can come into one of our facilities for treatment. So that program has been working quite well. It's one of our better established programs. And we have a lot of trained physicians who have worked with this program. And there are
Yeah,
many facets to the program, So
mhm.
I think we've been doing relatively well in this.
Yeah. Is there any resurgence of the malaria disease in Guyana?
Malaria, we are working to bring down the numbers. Last
Yeah.
year, I think we recorded about 20,000 cases. But these cases are predominantly in regions 1, 7, 8, and 9, with a little bit of 10. And we have come up with some different strategies because we recognize that persons might start treatment, but they don't complete treatment. So we have a project with USAID that is helping people to change their behaviors and become more compliant. And in fact, when we give people the medication now, if you have to take the medication for 14 days, you see an image of the pill on the envelope that you receive, and you can tick them off. So day 1, day 2, day 3, day 4. In that way, I think it's more persuasive, and we are getting better response by doing that. But with malaria, we have also distributed large amounts of bed nets, and these nets can prevent people from being bitten in the nights. So we have distributed last year about 57,000 bed nets, and we have gone into a lot of mining areas, and we have also distributed hammocks that has nets on them. These nets and hammocks, they contain insecticide. So when the mosquito land on the net, they come in contact with the insecticide and they die. So in one way, we are helping to prevent the spread of malaria. But these programs, I think, they're being well received in the interior because people have commended these programs because they see
Do
the help that it's giving to them.
do you receive any help from WHO, PAHO? etc., these international health organizations for your programs?
We have been working very closely with PAHO, and we have funding coming through the Global Fund. This was something that we have been able to tap into for many years. And Global Fund has been helping us with HIV, TB, malaria. And more recently, last year, they also give us some grant funding for COVID-19.
Okay.
So this has been one of the agencies that have assisted us with some of these programs.
All right. Thank you. I want to go on to the pediatric and maternity hospital.
Sure.
The sod tornado already happened, I think, over the last weekend. If you can comment on the importance of that institution.
So one of the president's priority item is really to make sure that we reduce maternal deaths and that we are able to provide higher quality of healthcare for children in Guyana. And one of the ways that we see us doing this and doing it well is to develop a specialty hospital. So over the last maybe year and a half, we have been working on this project. And what you see just last Sunday was, you know, the efforts after lots of hard work, after months of hard work, we have gotten to the point where we have been able to turn the sod for this new facility. What would be in this new facility? It's really 256 specialty beds. We will have almost all the subspecialty for pediatrics in that hospital. It would also contain about 100 beds for high risk mothers. So, women who during pregnancy, for one reason or another, would have various types of risk, would be able to get care at this hospital. Of course, we'll have neonatal sections and so forth at the hospital. Um, some of the things that we cannot do right now, we'll be able to do at that hospital. So, for example, we are going to put in an oncology unit in that hospital so we can cater for kids who would have need for treatment in various types of cancers. We would also have in that hospital capabilities of doing different types of surgery. And one of the programs that we'll introduce there is to do pediatric cardiac surgery. As you know, right now, if we have to do pediatric cardiac surgery, we have to send these children abroad. And it's unfortunate because before 2015, we had actually started a pediatric cardiac program in Guyana, and we were doing the surgeries in Guyana. And during the time of the APNU, they've actually abolished that program. So we are now in the process of restarting that program, bringing the players back together, buying new equipment to restart that program. Um, by the end of the year, we should have that program up and running. And once the hospital is completed, we would be able to move this program seamlessly into that new hospital. In terms of diagnostics, we'll have modern equipment there to do imaging, MRIs, CT scan, and so forth. All of that would be in the new facility.
So
So,
who's funding that hospital?
well, ultimately, it's the government of Guyana. We are spending 149 million euros to build that hospital. Um, we have the UK has agreed to fund this hospital, provide the funds up front, and it's being built by one of the foremost companies in hospital design and construction. This is an Austrian company called VAMED, and they're partly owned by the Austrian government. We also have an MOU with the Austrian government, and so through that MOU, this is one of the facilities that we have been working with them on to
All right.
construct this particular facility.
Before I pass you over to Dr. Ganga Ramdas, I have a final question in this section. If you can, not really a question, if you can enlighten us on the number of hospitals, new hospital you are building countrywide, and if you think that is adequate to meet the needs of the population.
We're
So
looking at Guyana's case, right?
Wait,
yeah.
wait, Dr. Ganga, wait till Dr. Anthony answer this.
So apart from the pediatric hospital that we're going to be doing, one of the other well, the other set of hospitals that we're working on currently is to do 6 regional hospitals. So if we start on the eastern side of Guyana at Skeldon, we have had a cottage hospital at Skeldon. And over time, that has become quite inadequate because we have been adding bits and pieces to that compound, and it doesn't function as it should. So, not very far from Skeldon, we are going to a new site, um, and we are going to construct a new regional hospital there. And once that is completed, we are going to we are going to transfer our operations from Skeldon to that new site. That one would be in Region 6. In Region 5, we're building a new hospital at Bath. Um, and once that is completed, it would, in many ways, replace Fort Wellington Hospital. Then, when you come in Region 4, we are going to put in a new hospital. This one is going to be located on the East Coast at Enmore. And so, right now at Enmore, we have, and that hospital is going to be built on the site of the polyclinic. On the East Bank corridor, we are going to build a new hospital at Diamond, and that would replace the current facility that we have that does not have a lot of inpatient capabilities. When we go across to Region 3, uh, there's been a lot of growth in the Parika area. And so we are building a new hospital at Dikendron to take care of persons and the population growth around that Parika area. And in Region 2, we are going to build a new hospital in Anna Regina. And again, that's because most of the population is concentrated around that area. Now, what are these hospitals? Basically, what we have in all 6 of these hospitals, we'll have about 75 capability for about 75 inpatients, both surgical, pediatric, and for internal medicine, male, female. We have 2 operating theaters. We'll have a minor theater. Of course, we will have an accident and emergency area, a modern laboratory, modern diagnostic capabilities, modern imaging capabilities. So each one of these hospitals would now have CT scans and things like that, and a lots of outpatient capabilities. So what you will see is a vast improvement from what we have right now. If somebody in Essequibo right now would like to do a CT scan, they'll have to travel all the way to Georgetown. So we are going to change the dynamics of all of that. People would have these facilities closer to home. And in terms of making the diagnosis, when you do a CT scan in any one of these facilities, they'll be uploaded to the cloud, and then we download it at GPHC, where the radiologist there would be able to read it and send back the results to the doctor. So right now we are doing that for New Amsterdam, and we are going to extend this network to the other 6 hospitals that we are putting in.
But
In addition to these 6,
didn't your ministry also work on enhancement of a number of hospitals as well to
sure, yeah.
improve the technology and the services?
So we have fixed up Diamond, the diagnostic center that we have at Diamond. We spent about $1 million US there last year, and so that's up and running, functional. We have partnered with the UK, and they have a concept of a smart hospital, and so we have converted the Diamond Diagnostic Center into a smart hospital, and which means that we utilize solar power. We can convert rainwater and use it back into the facility and so forth, preventing it from these facilities from being flooded. So we're making it more climate resilient. So floods and so wouldn't affect these facilities. So Diamond is one such area. We have also completed Lenora, and that is going to be open next week. Um, we have completed Mabaruma. That is going to be open sometime during this month as well. And we have completed Lethem. That one we have already recommissioned. The president was up there and he has recommissioned that hospital. So that's fully functional. Then through that particular program, we have also completed Paramakatoy. They have a few little things to complete. And so by next month, we'll be able to commission that. Port Morant Hospital, you would recall that we have the National Ophthalmology Hospital there many years ago, right? And under the last government, they literally had shut that facility down. So we spent a lot of money to overhaul the facility, buy new equipment, new operating microscopes, and all of that. And so far, we have completed about 500 surgeries. And one of the beauty of this particular facility is that we have been going out into the hinterland communities, screening people for cataract. Once we are able to diagnose them with cataract, we put them on a list, and then we fly them out, take them up to Port Morant, operate on them. Once they're better, we send them back in. And so for Region 9 and 2, we have already done about 100 surgeries for persons from these two areas. Continue doing that until we clear the backlog. And that has been a very good program. A lot of people have been very, very happy that we are able to provide cataract surgeries for them. And all of
I-
this, of course, is being done free of cost.
Is any such surgery done at Georgetown Public Hospital?
Yes,
Yeah.
we operate at Georgetown Public Hospital as well, but we're using this facility to clear the national backlog.
Okay.
And we have local surgeons as well as overseas surgeons who are based at Port Morant, and they operate on a weekly basis there. We
Okay.
also, we have also introduced another very, very interesting program. And just this morning, I was at one of the facilities where we were doing that. A lot of people might have hearing difficulties and they cannot, previously, if they needed a hearing aid, they had to go and purchase that. And sometimes it costs maybe about 65,000 Guyana dollars. A lot of old people cannot afford to pay that amount of money, right? And so one of the things that we have done is to remove that 65,000 cost. So you can literally come into any one of our facilities, be tested, and once you have a hearing impediment, we'll give you the hearing aid free of cost. And that program has started this year, and already more than 150 persons have benefited from that program. This morning, I saw some school children who came in to get their hearing fixed, and it's so pleasing when you can see how these children have responded.
All right. Thank you, Doc. And now I hand you over to Dr. Ganga Ramdas. Dr. Ganga.
Yes, sir.
Dr. Ganga,
Yes, sir. You have a
over to you.
question? Oh, uh, I need to look at things in a broader perspective. The 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 staffing or the labor problems that we're going to be exposed to down the road are very important. Given that our wage structure is quite low, we have challenges to attract and retain physicians, nurses, lab technicians, and other skills within the industry. So the question is, how are we going to tackle these? One way out, one solution would be a basic contract plus special allowances we have to make the inducements so that the wages, the competitive wages in alternative opportunities for physicians and nurses are comparable. We don't lose these people over time.
Yeah.
So that's the first point. The other aspect is what Minister Anthony has already touched on, and that is the partnering with donor countries. Now, he did mention that the government of Guyana would spend the amount that was reported as 149 euros. Now, is that a loan? I'm not too sure about that. Or is it coming from Austria? That's something that we need to clarify, because if it's a loan, then we have other opportunities as well, other countries, and we need to court those other countries in terms of our needs. Then there was the recent Hess grant. Now that grant is something that any any person or institution, especially institutions, they can establish a need. All you need is a need, the donor, and a proposal. So I want to make that clear to our potential entrepreneurs who are listening. You need three things: establish a need, identify a donor, and so far one oil company has donated, and write a proposal. Now that proposal, I believe, was written by the Sinai Hospital, and so they would be in control of the budget for that particular grant. Now it would do a lot of good to us through our ministry, through our departments of health, and the direction of Dr. Anthony. But we must bear in mind that they're in full control. The the budget for that grant, if if it becomes like a model for other entrepreneurs, that would help Guyana to attract more funds. Now, um, in 2005, I wrote a grant proposal related to U.S. healthcare cost reduction. Now, looking at that 2005 and then later 2009, two proposals that were funded as spin-off from a major grant disbursement in the United States. So we need to look at opportunities, let's say, for UG graduates and other graduates, how they can write small grant proposal and tap into external funding and other private donors. So using um, the Hess model, they can learn from that. So, Hess and cyanide and a proposal, three things. And if we do that, it will help us to enhance and acquire additional resources. So those are some broad comments. The other thing is to simplify the understanding of the system so that the students from high school to university level can plug into the system. They can plan their careers. So, in terms of the health system, you have money, you have man, let's use that money, man, machine, medicine, and then the platform, as President Ali said in one of his speeches. The four M's: money, man, machine, medicine, uh, platforms, and then most importantly, cost control. In order for us to be remain competitive, we have to know what are the cost centers and how do we control those. One of the things that could be done would be auditing. I did see a comment about reporting. Now, reporting is okay, but it's not the best way to go about controlling the cost in a kind of a neutral way. You don't want to be policing the system. The healthcare system is one of the soft sectors, so you want to have fact-based kind of control. So in the United States, we have the AHRQ, that's a health control organization that's statistically based. So with those statistics, we're able to make recommendations for quality improvements. So I'd just like to point that out that our statistical systems, supporting systems, will be very important in the healthcare industry. And we must base our requests for funding based on statistics that are shared with those entrepreneurs who would like to tap into or the widest sources of funds that are out there. So those are my general comments on some of the hot buttons that I thought about for this presentation.
Well, thank
Okay.
you very much. I think that that's quite a lot of things that you have touched on. Let me see if I can respond to a few of them. So I think the first one that you raise is pertains to human resources. And indeed, it has been a challenge to retain human resources. I think on the side of the doctors, we have been doing much better. And it might surprise a lot of people that we not only train doctors at the University of Guyana, but there are lots of other private training programs. And when they finish that basic training, we have created a postgraduate training institute, and we offer 14 different specialities. So we are able to train our own orthopedic surgeons, uh, pediatricians, and all these different fields. So we have over the years been able to develop, I would say, quite a strong postgrad program. So much so that we are attracting interest now from some of the Caribbean countries who would like to send their doctors to Guyana to be trained. So with the doctors, I see a lot of them staying. I don't see so much attrition among doctors. Um, Among nurses, however, we do have a problem because we have some countries that are coming into Guyana and doing active recruitment of our nurses. And generally, they try to take our more experienced nurses. So that has been a problem. One of the things that they do is to give them a package where not just the nurse would go to that country, but they try to get the family to go. And so when a whole family moves, I think it's a little bit more difficult, trying to stop that kind of a trend. We are certainly cognizant of these types of movement. And one of the things that we want to do, because as you would know, we have three nursing schools in the public sector. We provide most of the training for nurses in Guyana. There's just one private nursing school. So we train maybe about 250 to 275 nurses per year, but that's not adequate. So by the end of this year, we are moving to a hybrid program where we'll be recruiting many more nurses. They would be doing the theoretical component of the registered nursing program online. And then we are developing simulation centers where they will come in the different regions and they will do the practical component of the training. So this is a new form of training people here. And I think looking at the experience from other countries, I think this is a model that can allow us to scale up and train a lot of people faster and be able to replenish the system. Certainly, we will have to look at retention policies. And one of the things that the Mount Sinai group is going to work on is to help us to devise some of those retention policies. We are currently partnering with two major institutions to look at nursing education, or three rather. Um, these are Mount Sinai, their global health school, One component of what they'll be doing is looking at our nursing program and offering advice on how we can strengthen the clinical areas in our nursing program. We also have a partnership with York University, and again, to do some similar things. And we have a partnership with a WHO collaborating center in Brazil, and that team is going to be in Guyana in the next 2 weeks, and they would be helping us to implement this hybrid program starting in another few months here in Guyana. They've also trained a number of persons to be able to do a master's in nursing, and in some cases, some local nurses have graduated with a PhD in nursing. So this has been a very good and close collaboration that we have had with the Brazilian Collaborating Center, and this partnership is going to continue. So we are going to train more, we are going to have more experience nursing, but yes, we do have a problem with attrition, and we are working to fix that. I think a lot of countries have those types of issues, um, but we'll have to see what kind of retention policies we can develop to make sure that we keep more of the nurses here. Pharmacists, other categories of healthcare workers, we have been doing a lot more work with them, and hopefully we'll see more people being retained. I think with the transformation that is going to be happening in health and the types of things that we are putting in, the systems that we are putting in, the opportunities that people are going to have here, I don't think people would want to migrate as much because these opportunities are going to become very, very attractive as things roll on over the next couple of years. Um, and we do have, I would say, in the ministry alone, we have more than 20 different training programs. And just in over the last 2 years, we have trained a lot of community health workers. So now every community in Regions 9, every single village in Region 9, they now have two community health workers. Every community in Region 1, they have two community health workers. And that's because of the investments we have made in these areas. And one of the things that we'll be doing to help to transform healthcare, because remember, these are remote places. So we would not be able to put a doctor in these remote areas. But what we'll be putting telemedicine. So right now we are piloting a system where we have introduced, we'll have a satellite link. You will have a computer. We are training the community health workers to operate that system. That laptop would have internet-enabled devices. So a doctor in Georgetown would be able to guide that community health worker how to put a camera to the eyes so we can see what is going on with the eyes, put a camera to your ears to see what's going on there, put the stethoscope to the person's heart so that we can hear the heart sounds or the breath sounds in the case of the lungs. They would have internet enabled devices to do ultrasounds, and all of that we'll see live, and the person in Georgetown would help them to make the interpretations so that you will have a better diagnosis happening there. And once that person is properly diagnosed, they'll have the medications to be able to administer to that person. If that person needs to be referred upwards, the doctor would offer that type of consultation. So right now we're in the process of piloting that system. We are looking at 4 very remote sites, including Guns, which is one of the most remote villages in Guyana. And once that system works as we envisage it to be, then we are going to scale that up to other communities. And therefore, our level of primary health care would certainly improve. So
Right.
human resources, certainly, we have been tackling that. In terms of the issue that you raised about partnerships, we have a lot of partnerships with the UN agencies, for example, PAHO, UNICEF, WHO. Um, we have also been working with bilateral partners like the United States. So we have grants from USAID, and USAID had funded some work that we were doing in HIV. And because of COVID, we had gotten them to extend those grants. And we are going to go into a new era of bilateral cooperation with the United States because we have the Office of Global Health in the Secretary of Health's department has reached out to us. And so we are looking forward to building some collaboration with CDC. We are going to build some collaboration with the US Food and Drug Administration. And we are going to be doing some more work with the NIH, the National Institute of Health. In fact, right now, we have a few grants from the NIH that we are implementing. And so that has been very good. And I'll touch on that in a few minutes. I spoke about the Global Fund. They have been a good partner with us for a number of years, more than 20 years. And they have been working in malaria, TB, HIV, and more recently in COVID. Um, we have also been working with some of the banks, IDB, World Bank, and we have received funding. So we got some funding for COVID from the World Bank, and that has assisted us in strengthening our cold chain. With the IDB, we are working now on a current project where that portfolio, we are going to look at redeveloping the Georgetown Public Hospital to make it our main referral hospital and to do a lot of the specialty types of work at that hospital. And we are going to redevelop Linden and redevelop New Amsterdam. So these are three hospitals that is slated for next year. We have an Indian grant of 17.5 million US dollars, and that was intended to do West Demerara Hospital, Bartica, and Saudi. But after the design of the facilities, when the architects finished the design and we cost it out, we realized that we would only be able to do Bartica Hospital. So we are right now, looking for funding to make sure that we can complete Saudi and West Demerara. So in terms of where we are getting the resources from, we have been working with not just the UN agencies, but we have been working with some of the banks to make sure that we can get funding. The pediatric hospital, it's the first time that we have received funding from UKIF, that's the UK Export Bank. And so this is a loan that we have taken with UKIF, and this is 149 million euros. So that money is being used to fund the pediatric hospital, and the government of Guyana would be paying back that loan. So it's our money. We have borrowed that money, and we are using that money to be able to finance this hospital. And the rates that we have gotten it for is very good rates. So we don't have a problem with borrowing from UKIF. But it's the first time, and it would pave the way for many other investments that we'll want to do using this particular facility. In terms of other partnerships that you touched on a little bit, we do have, as you know, the partnership with Mount Sinai. And this is a collaboration that we have full control over, and we determine the areas in which they're working in. So we have identified three main components. The first one deals with modernizing the Georgetown Hospital and working to making sure that the hospital would meet JCI standards. And so that is one of the components that we have in this particular exercise that we are doing with Mount Sinai. So Morningside Hospital, one of the hospitals within the Mount Sinai group, the leadership of Morningside Hospital has been twinned with Georgetown Hospital, and they are working very collaboratively in different areas. So you would see different systems in Georgetown Hospital being improved over the next couple of years. We also have a component that is going to be working directly with the Ministry of Health, and this includes developing national strategies regarding health across the country. We'll be focusing a lot on preventing the chronic non-communicable diseases like diabetes, like hypertension, putting in all these protocols in place to make sure that you know we can prevent these diseases. But almost all the chronic diseases that you can think about, we'll be developing protocols, making sure that we are implementing them, putting new systems in place. Um,
Doctor, I want to ask you about the situation with suicide in Guyana.
sure,
I know under the previous PEP government, they had a National Commission on Suicide Prevention, but that was not continued under the past government. And there was an attempt for legislation that was introduced by Dr. Vindhya, and it was rejected. But now that the PP is in office, I think this motion was tabled again, some suicide prevention bill. Can you give us a status? And
sure.
what resources are really allocated? Is the government really taking this seriously? The vast majority of people do not think so. I can tell you that. So if you
Well,
can clarify and educate
sure.
us on that.
So, look, suicide is a problem, and we know where the hotspots are. And we have been working on making sure that we can provide services in these areas. Now, in the previous government, what you had was about 20 something persons in a psychiatric unit, which was based in Georgetown. You cannot manage suicide if it's in different regions, manage it centrally. You have to put people in the field. And that's what we are now working on to make sure that we can deploy people out into these regions and build capacity into these regions. So, over the last couple of months, the National Psychiatric Hospital that is located in New Amsterdam, we have reorganized that facility. We have new persons that we have put there, staff that we've put there, psychiatrists that are there, and they're reorganizing that facility. And we are offering outreaches from that facility to go into the communities where especially we see a number of cases. Suicide, one of the things that we have to do better is to diagnose depression. And there are persons who would come to the health system with depression, but they go undiagnosed. And so we have a program right now where we are training physicians to be able to diagnose depression. And once we are able to do that and pick it up early, then we'll be able to prevent a lot of the persons who are likely to be vulnerable to suicide. But so that there are a number of interventions that we are making right now. And these are ongoing things that the Ministry of Health is doing. On the legislative side, as you know, our laws currently, if you attempt suicide, you can be jailed for 2 years. That's on the books right now. So we are removing that. We are repealing that. I have put a bill the last session in Parliament. I laid that bill, which is the suicide prevention bill, and that would come up at some point for debate. And that laid out a whole set of things that we'll be doing for suicide, and it would be funded. The government has given the commitment that the suicide plan that would be developed would be funded. So we are going to change the outcomes, and we don't want to have this infamous statistics that we are one of the countries with the highest suicide rate. We are going to change
Yeah.
that. In addition
Yeah.
to all of this, we currently have a collaboration with Columbia University. And through that collaboration, they have started a 5-year project here in Guyana. And we are studying what are the causes of suicide, how we can respond. And we have some of the foremost, what I would say, global expert on suicide who are working with us. And so once we detect these factors, we'll be able to respond more appropriately and have more appropriate measures that we'll be taking. Columbia University in November would be hosting a wellness conference in Guyana. And again, they would be bringing in, this would be the second one, and they will be bringing in some of the top global experts to Guyana for this wellness conference. And some of the papers that will be presented deals directly with suicide and what we can do and all of that. So we have been doing a lot of work. Maybe we have not been talking much about it, but a lot of work has been done. And we'll continue to do it until we can reduce the
Because
cases.
I can tell the general impression of the public is that because suicide victims do not have a constituency, that is why they get the impression that not much attention is being paid by successive governments on this. So I'm glad that Colombia now is playing
Yeah.
a critical role and that the U.S. minister is taking good charge as Dr. Ramsamy did. He had the gatekeepers program going, and that had some very good tangible results. So
So
I'm
actually, we are building back some of those things. We are reintroducing gatekeepers and so forth in the community. So we are doing some of those things as
Mhm.
well. And this is the Columbia collaboration. This is one of the NIH grants that we have, and this is for 5 years.
5 years, okay.
Yeah,
All right.
and just recently, just this year, they got another grant. So we'll be studying accident victims and what can be done to prevent accidents.
I mean, the road fatalities, the road carnage is outside your remit, but that is terrible.
But we see it on the other end, because they come into the hospitals. So if we can do prevention, we'll have less cases.
Right, I think Dr. Tara is having some technical issues. So at this point, we're coming close to the end of the program. Dr. Frank Anthony, I will give you the opportunity to give your closing remarks before we end our program tonight.
Well, thank you very much for having me. I think there are lots to discuss pertaining to health, and we're just getting started. So um,
Exactly.
maybe on another occasion I can come back. But there are lots of interesting, innovative programs that we're doing in health, and you know, we would love that people can understand what we are doing. But more so, I know that in the diaspora, there are lots of people who work in health and they would like to contribute. They would like to come back home. Maybe not permanently. We would be happy if they come back permanently. But if they want to come in and do some part-time work and things like that, we are always willing to collaborate. So we have had surgeons and other professionals who have been coming back and going into some of the hospitals, working with us to do surgeries. Some people have come back and they've been doing teaching. Some people have been helping us to develop medical research. So, whatever is your field, and if you want to contribute and give back to Guyana, we're willing to work with you and partner with you. I think this is one way that we can learn. And as you have heard, the president on many occasions stated that we would like to transform the health sector. We are now working to build a world-class health sector where care would be equivalent to first world care. And that's what we're aiming for. And that's why we have chosen some of our partners who are known for clinical excellence. So Mount Sinai being one of them. And we are going to work with them on some special projects, including developing a cancer care program, developing a cardiovascular care program. And this month, we have a number of teams from Mount Sinai that would be coming into Guyana to start the preliminary work in these directions. So there are exciting times ahead, not just developing infrastructure, but also the human capacity to be able to deliver better quality of healthcare in Guyana. So, we just want people to come and join us in this transformation.
Well, I
Shaniza.
certainly believe that, it takes teamwork to make changes, to make
Sure.
things better. And nothing better than having your own people, right? So our people, if you're for our viewers that are watching tonight, there are opportunities back home. If you would like to know more, please reach out to any one of us and we will get you to the right place. But tonight we heard, unlike many things, there are challenges. You
Sure.
heard of the many challenges that we face as a country. We face challenges here in the US and many other countries around the world. Some of the challenges we heard is retention of nurses. That's a problem, I think, worldwide, right?
Yeah.
Funding of major hospitals. We heard about diagnosing depression, which sometimes lead to suicide, which most of the time leads to suicide. Some of the things that we heard that is, I'm very happy to hear, is COVID is under control in Guyana, monkeypox is under control, HIV is under control, and so many other things that are under control. And we have our very knowledgeable doctor here and his team, and many others that are currently working on making Guyana a better place for all of us. So, with that said, I thank Dr. Tara for being here. I thank Dr. Gangadas for being here, and Dr. Frank Anthony. It was a pleasure having you this evening.
Thank you
Until
very
next
much.
time, this
Yes,
is the Guyana Dialogue. Have a pleasant
thank you
evening.
very much, Dr. Anthony. Your
Good
presentation
evening.
was solid.